Hi there. Good evening. My name is Dr. Adrienne Neithardt, and I'm a reproductive endocrinologist and infertility specialist with Boston IVF, as well as with Delaware Institute for Reproductive Medicine, or DIRM, which is a Boston IVF partner clinic. I had a question here about someone asking about considerations specific to reciprocal IVF. Reciprocal IVF is what some people refer to partner-assisted reproduction is another way to say it, meaning most often seen in a female couple where we're going to utilize eggs from one partner to create the embryos, and then the other partner is going to carry them. And obviously there's different considerations because you have everything that we're talking about in this gamut, but now you've also have two people that you're getting ready for this with two different medical backgrounds, maybe different ages. And everyone comes to this with a different journey. Sometimes a female couple may come and have no history of infertility and I don't consider you infertile until we've proven that there is a problem. But in order just to go through this, I would expect that there's going to be a workup, an evaluation for both of you, each person who wants to be involved. So the person who wants to donate or utilize their eggs, what we really want to look at is ovarian reserve. We want to look at we always do basic anatomy scan, make sure we can access the ovaries, we can access the eggs, make sure your general health is good. You want to do genetic carrier screening. When you utilize sperm from a donor, whether it's a known donor or it's an anonymous donor, you want to make sure that the eggs you're going to use and the sperm you're going to use are compatible genetically. And when I say that, meaning that you're not carriers of the same recessive genes. And I often encourage female couples for both to be tested if you think that at any point you may use both of your eggs. So you kind of take all of that into consideration. Whenever I have a conversation with a female couple, even if a couple comes in knowing kind of, well, this is what we want to do. These are the eggs we want to use. This is the uterus we want to use. For a lot of people, they don't know, or that changes as we go through this and as we learn things. So I really try to have a whole conversation about what's your total family building look like? How do each of you want to participate in that? What's that going to look like? And then we determine what kind of testing we need to do and what's the appropriate treatment. So my recommendation is come in, have a conversation before you're ready to start so you can start thinking about some of these things, and it'll help you with your decision making moving forward. Boston IVF and DIRM, Delaware Institute for Reproductive Medicine, are very, very comfortable with these type of cycles, both for female couples, male couples, any single individuals, anyone trying to build their families.